ABC special report. There are now 4,450 cases of coronavirus in Ohio. 142 people have died. The governor giving his daily update.
I continue to try to honor our state universities. Today I have Central State's tie on. Many years ago, I was a trustee at Central State. Central State is not too far from our home in Greene County. So to all Central State alumni out there, good afternoon, and we honor Central State today. Let me start with some photos from 4-H kids in Wood County. All of our kids were in 4-H, and Fran calculated one time how many straight years of 4-H we had. I think it was like 27 years or something like that, that we had kids in 4-H. So we have a real appreciation for 4-H and for 4-H leaders. And all that they do. These photos were sent to our office by Jennifer Morlock, who is their leader. She writes, and I quote, "We've been encouraging our 4-H youth in Wood County and across the state to post thank you notes to essential workers. It is a time for us to follow one of the 4 H's, hands to larger service." She continues, "My goal is to teach our youth that we can make a difference by reaching out to others no matter what the obstacles might be." End of quote. So we thank you, Jennifer, very much. Thanks for all the 4-Hers out there for recognizing our essential workers. We appreciate that very much. As you know, tonight at midnight, the requirements for our new stay-at-home order go into effect. And again, these are very similar to the previous order that we issued. There are, however, new requirements for retailers in this order, including determining a maximum number of customers allowed in the store. So our order requires each one of the retailers to post that number and to determine how many are in the store. I want to congratulate a number of our retailers who I've seen have already started doing this. Some of them have already posted the number in each store, and the whole idea is just to make a calculation of how can people continue to be safe at what number. We've also seen some stores that have actually gone to a one-way aisle. And again, the idea is to keep people from brushing up against each other or getting close to each other. So that sounds like a great idea if that works for your store. Basically one way, one aisle, and then the next one going the other way. So there's all kinds of imaginative things that stores can do, but we appreciate what they're doing. Some have taped off distances on the floor. Some are making sure that other things are done. And again, I know that our grocery stores are focused, as all our retailers are, on safety. I know a number of the stores have already advised me that they have already, even before our order, been wiping off, sanitizing the grocery carts that everyone uses, and so I congratulate them for that. And again, to all our essential workers out there in retail, who are making a difference so that we can continue to eat, continue to go to the drugstore and those things that are essential. Thank you very much for doing that. And as we indicated last week when we started talking about wearing the mask, I actually have this one. Fran told me to always keep this with me, so I've got this one. She made that this morning, I believe. And so what we're saying is, if someone's wearing a mask, that's a good thing. It's a good thing for someone to do that. I think it sends a signal that for all of us to continue to be careful. As Dr. Acton said, it's not a substitute for social distancing, but it can go along with that social distancing. Let me give you an update in regard to our hospital capacity. Big picture, of course, is that what you are doing every single day is buying us time. By staying home, by being very careful, you're buying us time. You're buying our hospitals time, the folks who work in the hospitals. Our goal is to double the capacity of our hospitals, number of hospital beds, as well as a number of all kinds of other things that we have so that the hospitals can accommodate up to doubling of the people that may be coming in. We have pulled resources and experts from multiple perspectives really to combat this issue. Major hospitals and medical systems have put plans in place for expanding their capacity within their own facilities or have collaborated on facilities. So what we're finding is many of the hospitals are being able to do this right within their own facility. We have also been building a plan to expand healthcare at alternative sites beyond what we traditionally think of as a medical care facility. Representatives from healthcare systems, local governments, county emergency management agencies, state agencies, the Ohio National Guard, among others, have teamed up in regions of the state to look at buildings that can support larger numbers of patients. After visiting various locations and taking a hard look at this, looking at things such as distance to an existing hospital, conditions safe for patients and healthcare professionals, and space to meet the region's expected needs, the following sites have been selected. Seagate Convention Center in Lucas County, Case Western University's Health Education Campus in Cuyahoga County, Dayton Convention Center, Covelli Convention Center in the Mahoning Valley, Duke Energy Center, Hamilton County, Greater Columbus Convention Center in Franklin County. So those all sites have been picked out as additional sites, as places where we can expand and put beds and see more patients. The assessment of other sites is going to continue as we look for additional space should that be needed. Now, the healthcare regions in southern Ohio and southeastern Ohio, they have determined that the existing hospital facilities in their areas will, with additional equipment, be able to handle the surge in patients without going to an off-site location. So that's at least the preliminary decision that has been made, if that is your part of the state. Let me give you an update in regard to procurement and what we are doing. Again, you are buying us time not only to expand our hospitals, but you're buying us time so that we can get the personal protection gear in, make sure there is enough of it for our hospital personnel as well as our nursing home personnel, first responders. This is all very, very important. We have put together a team derived from the public sector as well as the private sector to go out and make sure that we have enough of these items, not only the personal protection equipment, but also other things that are needed in the hospitals as other things are needed for testing. So as we continue to move through the crisis, we're working to ensure that our healthcare workers have the personal protective equipment, the PPE that they need. And let me just tell you what we are doing. If we can find it in the marketplace, we're going to buy it. If we can find it, we're buying it. If we can't buy it, we're going to make it or repurpose it. As I've said before, we are much, much too reliant on foreign countries. That is something that we will have to change after this crisis is over. The efforts, though, that we're making now in Ohio to address this crisis will help us today, and I believe will strengthen our manufacturing base in the years to come. Once we have our supplies, we're going to use technology and innovation to identify ways to make our supplies last longer. Prime example is Battelle. They're doing that. They're sterilizing masks. And what this means is each mask we're going to be able to use up to 20 times. It will go back in and be sterilized and then come back out. That's going to give us a great, great tool. We appreciate all the medical professionals, the companies, the schools, the colleges and universities, and individuals that have given PPE to this effort. We've asked them to take a look and see what they could spare, what they're not needing right now, and that is starting to come in, and we are very grateful for that. In times of crisis, as we have seen throughout our history, Ohioans act with great generosity, and so to all those institutions, thank you. Thank you for coming forward. We've had at least 1,400 Ohio manufacturers, companies who have responded to our call to try to help us. And so I want to thank each and every one of them. The Ohio Manufacturing Alliance has reached out to each one of these companies to see where they fit in and what help they can give as we deal with this crisis. I want to give a shout out to Jobs Ohio. Jobs Ohio has shifted its business development effort and is now working to shore up this critical supply chain. They know our manufacturing sector very well, and they know what different companies can bring to the table. And they're taking that expertise, and we're utilizing it each and every day. The Jobs Ohio team provides input as part of this Manufacturers Alliance and assists the state with rapid procurement requirements and identifying viable solutions. I want to thank former Governor Kasich and the state legislature for having the wisdom 8, 9 years ago, 10 years ago, to create Jobs Ohio. It is a tool that we very much are using as we go through this crisis. Our goal, as we try to slow down this virus, and we have made some real progress, by the way, and thank you very, very much, each and every one of you, for what you're doing. We're making progress. Thank you for all that. Our goal each day, as we ramp up and get ready for the surge, is to protect our protectors. Men and women who are in the front lines, who I hear from, who are in hospitals, who are in nursing homes, who are working in nursing homes, who are first responders, who are out there risking their lives every single day. I want to thank them. Thank you very, very much for what you're doing. What we're trying to do is to protect you. You are the protectors. Thank you for that. And our efforts every single day are aimed at protecting you. We'll continue to keep you updated on our efforts to secure PPE. We're going to do all that we can to protect Ohioans and those that are working each day to protect us. And I want to quote former Governor Bob Taft said in his 2005 State of the State address. I thought this was a pretty good quote, Bob. Ohioans are practical. We are a can-do people. Give us a problem, we'll give you a solution. So salute to everyone who's out there working to do this. I want to give you an update about what's happening in the only federal prison in Ohio. This is a place called the Elkton Federal Correctional Institution. It is located in Columbiana County. It is a federal prison. It houses federal prisoners. It is not run by the state, and it houses federal prisoners and not state prisoners. We know that 7 inmates have tested positive. We also know that dozens more have shown symptoms, and some of these very serious. 3 inmates have died. Over the weekend, on Friday and Saturday, I started getting calls about what was going on at Elkton in Columbiana County from local officials and others who were concerned about that. We started looking into this. I asked the Ohio National Guard state surgeon to visit the Elkton prison. And the Guard came back to me, as well as our health department came back, and said there is no doubt that this prison needs help. The head of Ohio National Guard, General Harris, tells me that Elkton's medical staffing right now is at only 50% of what it should be. And for every federal inmate at the hospital, they need 2 federal guards standing watch. And some of these prisoners are now out in the community at these hospitals. Now let me again, excuse me, say it. This is not a state facility. It's a federal prison run by the Federal Bureau of Prisons and the United States Department of Justice. It houses federal inmates from all over the country who are sentenced in federal court. But this prison is in Ohio. It is staffed primarily by Ohioans, our fellow citizens. Their families live there, live in the area. When an inmate gets sick, these inmates are, of course, transferred to local hospitals out in the community. So that is why today I'm announcing I've authorized the Ohio National Guard to go into Elkton Prison to assist. This is very limited. It's limited in duration, and it's limited in scope. Now, we have received today a formal request for assistance, and right now the plan is to go into the prison for 7 to 10 days until more federal assistance arrives. We have an advance team from the Guard there today, and we're prepared to send at least 26 guardsmen and women to the prison to help in the Elkton Infirmary. This is a medical mission only. The Guard members will not be armed. They will not be providing security. They'll be there to assist with non-COVID cases, as well as those who are showing symptoms of this highly contagious, deadly disease. These soldiers, who all work in the medical field, will have N95 respirators for protection while they work to augment the current prison medical staff. They will treat those they can while triaging others with serious symptoms for hospital care. The Guard also stands ready to help with transporting the seriously ill patients to the hospital in the event of a surge. In addition to the staff, the Guard will be bringing equipment as well as ambulances with them as well. As I've said, we've all said, we're all in this together, and providing state help for this federal prison is the right thing to do. In the meantime, however, I do feel that the U.S. Department of Justice and the Federal Bureau of Prisons should stop any intake going into that prison for any reason. And I specifically made that request last night on the telephone, a call about 9 o'clock at night with the head of the federal prison system. That's something that we feel very, very strongly about. When an outbreak inside the prison takes place, it's certainly not the time to introduce new inmates to that population. Additionally, we've been receiving calls from family members of inmates at Elkton asking us to release the federal prisoners. Let me be very, very clear. We do not have that authority. This is a federal prison. I have no authority in that area. Now let me talk for a moment about the Ohio prison situation and briefly where we are. And I'm going to say more about this tomorrow as we move forward. Director Annette Chambers-Smith will have more information in a release later. But we have 5 prisoners at the Marion Institute, the Marion Prison, who have tested positive. We have 5 prisoners in Pickaway County who have tested positive. Of the staff, we have 27 tested positive at 4 facilities, but most of the staff comes out of Marion. We kept the COVID virus out of the prison for quite some time, but now it is in some of these prisons. Let me go through what the protocol that's been followed by the director. We have been testing in the prisons whenever appropriate. This testing is not new. When someone had symptoms and a prisoner had symptoms, testing was done. On March 10th, we started screening staff that was coming in. They were screened by asking them questions about travel, asking them questions about their symptoms, asking them if they had a cough, etc. Each one was interviewed as they came in, every day, every shift. On March 18th, the prison started actually taking temperatures of the members of the staff who came in. The director curtailed programming. The whole goal was to have fewer and fewer people who would be coming in contact with the different prisoners. So people from the outside, religious services, other programming, where it might take people from the outside, those were curtailed. Everything that was done to curtail contact from the outside with the prisoner was done. I will talk tomorrow about some other steps that we're going to take in regard to releasing prisoners. Let me just kind of outline what my criteria is, what the director's criteria is, and what we are weighing. First of all, we're not going to release anyone who is dangerous. We have a long list. I went through the list the other day. The type prisoners we are not releasing. We're not releasing sex offenders, for example. We're going through the prisoners and taking a look at who might be getting close, who's in for a nonviolent offense, and who might be getting close to release anyway. Freeing that space will enable the director and her wardens to better deal with the situation. So these are some of the criteria that we're going to look at. I will have, as I said, more to talk about tomorrow in regard to that. Let me talk about something that occurs every year about this time, and that is the snowbirds coming back from Florida or Arizona, primarily Florida, I guess, coming back to Ohio. First of all, we welcome you back. We want you to come back. But we would, again, remind you that you need to quarantine when you come back. You need to quarantine for 14 days. Anyone coming into Ohio, whether a resident or a non-resident, needs to quarantine. The population that comes back from Florida is generally older, and again, you are the most susceptible. But whether you're old or young, if you're coming back from Florida, you need to quarantine. As we look at how we're doing, and this is something that Dr. Acton and I and the Lieutenant Governor talk about every day, actually, talked about again this morning. We're doing pretty well. We are doing the right thing. Ohioans have done the right thing. We have to continue on that. We cannot let up. And one of the concerns we have is that people coming into Ohio from other states will bring something in with them. And so that is why our order was issued the other day. But just as a very specific reminder to folks who are coming back from Florida, we want you to come back. We would say to family members who are welcoming their parents back or family members back, help them out. Tell them you'll bring food over. Maybe get the food before they come. Give them a helping hand so that make it easier for them when they come back, and they can enjoy the good Ohio spring that is here. Jack Marshbanks, who is our director of the Ohio Department of Transportation, is going to talk a little bit about this, and he's going to give you an update now on the Ohio Department of Transportation's efforts to keep us all safe. Jack? There you are.
Thank you, Governor. The team here at ODOT and all Ohioans appreciate your strong and steady leadership during this COVID-19 pandemic. I'd like to start by taking a moment to thank some of the behind-the-scenes essential workers who are keeping our grocery store shelves stocked and delivering needed medical supplies to our healthcare workers, our truckers. The trucking industry is always a vital part of the economy, not only for Ohio, but the entire United States. Their jobs are even more critical now. Every other industry literally relies on them to deliver goods that sustain the livelihood of the country. And we know this is a challenging time for this industry, as it is for all of us. At ODOT, we are working to help make their jobs easier by keeping our rest areas open, clean, and patrolled even as fewer and fewer people are traveling our interstates. We also revised our overweight permit process to allow shippers to get more goods faster to depleted store shelves. We know truckers have fewer options these days, as many restaurants move to drive-through only operations. So we are working with mobile food vendors to find suitable locations for them to offer hot meals to truckers. ODOT crews are also on the job, making needed emergency repairs and doing needed maintenance to our state highway system, all while practicing safe physical distancing, of course. We know the most important thing we can do for our truckers and for our state as a whole is to keep our roads safe. I want to take this opportunity to remind viewers Governor DeWine and Dr. Acton announced new requirements for travelers coming into Ohio, which will remain in place through the May 1st expiration of the stay-at-home order. As the governor mentioned, all travelers arriving to Ohio must voluntarily self-quarantine for 14 days at home or wherever they are staying. To be clear, we're not talking about truck drivers coming into the state to deliver goods or medical professionals coming in to help. We are not talking about people coming into the state to provide those essential services we all need right now. We are also not talking about those people who live near our borders and travel across state lines to go to the store or to the doctor's office or to work at an essential job. But if you are coming back to Ohio after being out of the state for a while, this does apply to you. If you took an essential business trip out of state or are one of our many snowboarders returning north after spending a winter in the South, this order does apply to you. It is very important that travelers and residents take this step to help protect their community by staying home for 2 weeks upon return to Ohio. If you need groceries or essential goods, you can have them delivered. Ask a neighbor or family member. It's one of the many charitable services that can help you get what you need while you're at home. ODOT has put messages up on our digital message boards on our borders to make sure travelers are aware of this requirement. We are also putting up signs on our rest areas to make sure travelers who stop there are aware of the requirement of self-quarantine. We know this is a lot to ask, but we also know that 2 weeks can pass very quickly, and doing so will ensure not unknowingly lose a cluster of disease.
Jack, I think we lost your mic there, Jack.
Do your part. Each other safe. We're in this together, Ohio State. Governor, thank you for the recognition.
Director, thank you very much. We appreciate it very, very much, and appreciate what you and your team are doing every single day. Thank you. Lieutenant Governor.
Thank you very much, Governor. I do appreciate all the great work that all of the employees across the state and everybody as part of the essential business services out there that you're doing to keep things going. As Governor mentioned earlier, the revised or the amended stay-at-home order with the essential business descriptions does go into effect tonight at 11:59. One of the pieces of that is the Dispute Resolution Commission. If you recall, what the Dispute Resolution Commission is designed to do is to essentially mediate and come to a decision when there is a disagreement between one or between two or more health departments about how to treat an essential business. We do know that there are some businesses who operate statewide, that they may experience one set of regulations in one community and a different set of regulations in another, and you're looking to reconcile them. That was the reason for the Dispute Resolution Commission. We heard this from local health departments and local elected officials that they wanted some place at the state to try to remedy these conflicts. And so the Dispute Resolution Commission has been designed to do that. The details about the Dispute Resolution Commission are at coronavirus.ohio.gov/business-help, and that is available on there right now. It is important to to know that we will make the deliberations for this and all of the information public information. So this will be done for the media out there, and for anybody else who's interested, this will be done in a very public way. And they expect to have a 24-hour turnaround time. So know that that is available, but it is not there to question the descriptions in the order. It's only there when more than one health department has a discrepancy in how they're implementing the order, and the dispute commission can resolve that. And that's the purpose for that commission. I mentioned last Friday about the SBA Payment Protection Program. This is to help small businesses under 500 people get access to loans. And many of these loans, much of the loan can be forgivable for things like payroll, to keep your employees on board, mortgage, rent, utilities. Those types of expenses could be forgivable under the terms of the loan. We encourage you to go to your banks. Many of them were up and running by Friday. Many more of them will probably not be there until midweek, but the applications are available, and I know that they're processing those applications as quickly as they can. But I also became aware over the last few days that there are some people, some businesses, that for whatever reason, they may be small businesses, either don't have a financial institution that can work with them on this, or there's something unique about their type of business where they can't get access to the loan. And you may recall that last week I said some of the mayors and I had a conversation with Goldman Sachs as part of their 10,000 businesses program. Well, Goldman Sachs is making $20 million available for Ohio businesses for this type of loan purpose. And so for those of you who work with your bank, and that's the first place you should go, your bank, your credit union, your traditional financial institution, that's your first place. But if that does not work out for you, here's another $20 million that's being brought into Ohio for this purpose. That will be under the banking update provision on the coronavirus.ohio.gov/business help file. It's not up yet, but it will be hopefully momentarily as we work through this. And I really want to thank Development Services Agency and Jobs Ohio and our Ohio financial institutions for the way that you're working through this. Also, we talked about the jobs that are out there. A lot of people losing jobs, but a lot of employers who are part of the critical infrastructure of our state, whether that be healthcare or the manufacturers that the governor talked about who are trying to build these PPEs and other products that we need. Maybe you're part of the food supply chain. When we talked about this last week, that the website, coronavirus.ohio.gov/job search, there are now over 29,000 jobs. This continues to grow by thousands of jobs a day that these companies need. So if you are in desperately need of a opportunity, or maybe you're a younger college student or somebody like that who is not in college but could even part-time work at a place, these are great opportunities to help pitch in, to help the team out there, the team of people who are trying to deliver the services we need. You can help them out by going to that website and getting yourself a new job that we all need to be filled. Now, finally, you see this big map behind me, which I'm going to turn to in a second. And Dr. Acton and I just had a great talk about the map before we came in. I always say that we should celebrate what we value. Celebrating success is the way to get more success. And this map, when I get into it, this map is a source of optimism that you have provided us, that you have provided us a reason to be optimistic about where we are in this fight against coronavirus. And I always say that to my kids, if you sacrifice now, you'll see the dividends later. Well, I want to turn and point to this map. As you see, this is, the red indicates that people haven't made any real travel restrictions since the coronavirus outbreak occurred. And the closer you get to the gray side, the less travel people have done. Essentially, the more they have been compliant with the travel restrictions and the social distancing, so to speak, that we've asked people to do, because we know that it works. We know that it's the biggest thing that we can do to slow the spread and to give us hope that we are going to get through this healthier and in a more timely manner. And as you see, Ohioans, you've been great. You really have followed the guidance that the governor has asked and Dr. Acton has asked. We've all asked of each other, not in this room, but all of Ohioans, I know, all 11.7 million are asking of each other, and most people have done it. And what we hope, and this is through the week of March the 23rd, because a lot of the data lag. And we hope that these sacrifices that you're making now are going to show up in the modeling that will be coming in the future, and that's why we're optimistic, because we're going to get the new data. Dr. Acton will have access to it in the near future, but we're hopeful that our futures will be changed. Our destiny is changed by your actions, and this doesn't mean we should let up a bit. This means if you stick to this and we see this through, we're going to come out the other side strong.
You've been listening to Governor DeWine give his daily update for the coronavirus here in Ohio. Here are some of the highlights. There are 4,450 cases of coronavirus in Ohio. 41,000 people have been tested, mostly those on the front lines and the critically ill. 142 people have died statewide. COVID-19 now in 81 out of 88 counties in Ohio. The state health director, Dr. Amy Acton, said more than 80% of people with the virus are at home with mild symptoms. They were never tested, though. Dr. Acton said that of the 303 patients who were hospitalized and released, 25% have recovered. The governor said tonight at midnight, those new requirements for retailers go into effect. A maximum number of customers allowed in the store must be posted and allow for proper physical distancing. The Columbus Convention Center is one of several large buildings around the state slated to take the overflow from hospitals if needed. And he said if we can buy or find supplies for like PPEs, we will either make them or repurpose them, and that at least 1,400 Ohio manufacturers have reached out to the state to offer help. He is authorizing the National Guard to go into the Elkton Federal Correctional Institution in Columbiana County for 7 to 10 days. He said it's a medical mission and they won't be armed and they won't be providing security. The governor also said it's a federal prison, not a state facility. 7 inmates there have tested positive for COVID-19, but dozens more have shown symptoms, some very serious. 3 inmates have died. He did talk about prisoners that could be released from state prisons tomorrow, but he also said that violent offenders won't be released. He said he'll have more on that tomorrow. And he asked snowbirds returning from Florida and other states to self-quarantine for 14 days. He also said the trucking industry is always a vital part of our economy. Their job's even more important now. The state is working with food trucks to provide truckers options for hot meals because, as we know, restaurant options are limited. And then finally, if you're a small business and your bank can't help you, Goldman Sachs is making $20 million available to assist. If you missed any of the news conference, watch it now on our website, abc6onyourside.com, and on the ABC6 News app. We'll see you at 5.